Okay, so our topic is postpartum body changes and exercise. So we're going to go over the changes that occur in your body up to 6 weeks after birth. I also have some light exercises at the end of this presentation that can be done. If you have had a cesarean, though, it is recommended that you are not lifting anything other than your baby for the first 6 weeks.
We are going to talk about the importance of prenatal and postpartum care and exercise. Prenatal care is healthcare that happens for the mom, baby, and family before birth. Prenatal care should ideally be started before the baby is conceived or as soon after as possible. Monitoring by a healthcare provider is important to address any concerns that need to be managed before birth, such as health issues or potential delivery complications. Prenatal care also helps families learn about what to expect when you are pregnant and the importance of self-care. Self-care is important during pregnancy as your body is going through a lot of changes such as hormone changes, body changes, weight gain, and mental shifts. Seek the support of your physician or nurse practitioner when planning a pregnancy. Exercise has been recommended during pregnancy as it can help reduce the risk of pregnancy-related complications. It can help to reduce pregnancy-related high blood pressure, gestational diabetes, constipation, changes to your bladder, decreased total gestational weight gain, and decreased back pain. Exercise is also related to decreased rates of C-sections and the use of instruments such as vacuums during birth. Exercise can also improve mood and severity of depressive symptoms, reduces the feeling of being stressed, enhance sleep, and increase energy levels. Some exercise include pelvic tilt, stretches, squats, yoga, Pilates, and walking. Water exercises are also an excellent option as they can take the baby's weight off of your joints and can help with back. Postpartum care is care after birth. The main purpose is to maintain and promote the health of the woman and her baby. During pregnancy, a woman's body undergoes many changes. The uterus expands to hold the baby and extra fluid. Muscle tones change in the abdomen, and hormones cause relaxation of the pelvis. Postpartum, the uterus gradually goes to pre-birth size by 5 to 6 weeks, and exercise is important to help restore abdominal and pelvic floor muscles. Constipation may occur, and your breasts may be tender and engorged as your milk starts to come in. New mothers will often experience some type of postpartum blues secondary to hormonal changes and conflicting feelings of joy and emotion let down during the first few weeks. Examples of self-care are exercise, meditation, quality time with your partner, and postpartum exercise is important for both physical and mental health. Doing moderate exercise helps promote healing and recovery from birth. Exercise can also help strengthen your abdominal and pelvic muscles as they have been weakened during the birthing process. Some non-strenuous exercises are stretching, walks, and yoga. Exercise is shown to improve mental health, and depending on the type of exercise, can be done on your own to have a little bit of time for yourself or with baby and family. Eating a well-balanced diet is important to support the nutritional needs of yourself and your baby, so a diet with lots of proteins, vegetables, and fiber is also important.
Okay, so these are just some interesting stats that I found online about breastfeeding. Feel free to have a little read of this if you wish.
I'm talking about patient assessment in postpartum. According to Bubble, he assessed patients' breast, uterus, bladder, bowel, any discharges, episiotomy and perineum, hemorrhoids, and emotions.
Okay, so your uterus should return to its normal pre-pregnant state about 5 to 6 weeks after delivery. For the first 10 days, the upper portion of your uterus should descend about 1 centimeter per day. It's also great to massage your uterus to prevent any excessive bleeding. So you would massage with the flat portion of your fingers with your dominant hand in a firm circular motion. You then kind of want to push in a downwards motion to get rid of any excess blood. Also, after pains are common in women who have had multiple pregnancies. You can take Tylenol for these pains. Aspirin is not recommended though because it will affect your blood clotting. Also, if you are breastfeeding, these after pains can occur for a longer period of time. Okay, so we want you to pee as much as you can because sometimes you're not fully emptying your bladder, which in turn could lead to infection. In regards to constipation, we want you to try and drink and eat a diet that's kind of high in fiber, which will help with constipation. You should also try and get up and walk around as much as you can. For women who have had cesareans, a stool softener might be ordered for you. Okay, so the return of your menstrual period is usually about 5 weeks after birth. If you're breastfeeding, it could be longer. We do recommend that you get some kind of contraception in this time because ovulation can occur before your actual period comes and then resulting in you being pregnant once again. Also, in regards to sex, it's safe to resume when bleeding has stopped and you kind of have healed down there. Your vagina also doesn't lubricate as well for the first 6 weeks after birth, so we recommend that you getting a lubricant. This will make intercourse more enjoyable for you. You also want to get something that's water soluble, such as KY gel. Okay, so we're going to talk about lochia, which is the vaginal discharge that occurs after birth. This is normal and expected. So during the first 3 days, it should be bright red. And then from days 3 to 10, it should be more of a pinky kind of color. And then finally from day 10 to 21, it should be mostly clear and a colorless kind of mucus texture. So we would want you to look for any abnormal characteristics such as foul smelling discharge, if you have a fever, if you have blood discharge that's going beyond 3 days, unusually heavy flow or any clots that might occur. And then obviously you want to report this to your healthcare provider. Also, women who have had cesareans, this is generally much less. Okay, so your breasts, they may be soft or engorged 3 days after baby. They can look hard, erect, or just feel uncomfortable. So we want you to observe your breasts for any reddened, tender areas, cracks on your nipples, or just overall general soreness. It's also recommended that you wear a nice supportive bra for your heavier breasts, making sure that it's not too tight though to impede circulation. If you are deciding that you do not want to nurse, it's recommended that you try not to stimulate your nipples as this can cause lactation. You do want to wash your nipples kind of just in plain water, as soap can make them more dry, which will lead to cracking. Also, for those women who have cesarean births, the only thing that you really need to know is that your production of milk could be a little bit slower coming on. Okay, so the area between your vagina and your anus can be swollen and quite sore after birth. For the first 12 to 24 hours, you can use an ice pack to reduce swelling and help numb the area. You do want to make sure that you cover it in some kind of cloth to prevent any damage to the tissue in that area. And you want to wait 20 minutes before applying another ice pack. Also, when you're wiping, you want to make sure that you do front to back, because you don't want to get any microorganisms in your incision if you have. You can also use like a little plastic bottle filled with warm water, and then you can kind of just squirt over the area in a front to back manner, and this will also prevent any bacteria from getting into your vaginal area. So to reduce pain when you are sitting on the toilet, you can try to squeeze your bum cheeks together as you're going into a sitting position, or you can kind of buy like a little donut pillow that you can help to sit on the toilet with. So women who have had a C-section, we just want to let you know that you want to kind of hold your incision site if you're coughing, laughing, sneezing, or even moving around. Okay, so swelling in those legs. The best thing that you can do to prevent it is to get up and walk around as much as you can. Or if you're sitting down, it's best to kind of elevate your legs. Women who have had C-sections are likely going to be prescribed something to prevent blood clots, because you're not going to be able to walk around too much for the first few weeks after birth of baby. Okay, so we just want to let you know that postpartum blues are totally normal and temporary after birth. If you are still feeling low 2 weeks after, it is recommended that you do go and talk to your local healthcare provider. Women who have had cesareans, the hormonal fluctuation might be delayed, meaning that your postpartum blues could come a little bit later. There's also lots of resources out there that can help you, support groups for women who are going through the same thing that you could talk to. Okay, so my last 4 slides here are on exercise, and I have a couple little different exercises that you can do basically right after birth. For those who have had a cesarean, though, again, like I said before, it's not really recommended that you're doing anything for the first 6 weeks other than lifting up your baby.
Hi, my name is Titila Yogoshe. So I'll be explaining the nursing intervention for postpartum changes and exercise. So the first one is the nurse will monitor the patient's vital signs, which will give the nurse the baseline value of the patient's state of health. For example, when a patient has an elevated pulse rate and temperature, it could be a sign of infection. Then the second one is that the nurse will encourage patients to perform routine exercise such as the pelvic tilt, which helps to tighten the abdominal muscle, the Kegel exercise, which helps to tighten the perineal muscle. Then the nurse will educate the mom about the benefit of breastfeeding. For example, when you breastfeed a baby, it will help provide essential nutrition to the baby, and it will lower baby's risk of diseases and infection. Then the first one is Lucia, which is the vaginal discharge after birth. So the nurse will assess the lucia frequently, which should not be more than 1 saturated perineal pad in 1 hour during the first week of birth. And also the nurse will explain the color of the lucia, which should be red or pinkish in color and can last up to 25 days. Then the fifth one is the nurse will gently palpate the patient fundus if the uterus is firmly contracted. And also the nurse will educate mom about cramping during and after birth, which is normal. For patient who has cesarean birth, the nurse will inspect the suture for opening or presence of drainage and odor, and the nurse will also teach the patient to keep the incision area clean and dry. For the bladder, the nurse will assess for distension. So, for example, if the patient's uterus is high and deviated to one side, if the patient can walk, the nurse will encourage the patient to go to the bathroom to urinate. The nurse would educate patients at discharge for signs of infections, and for bowel function, the nurse will encourage the patient to increase dietary fiber intake by eating food such as whole grain, vegetable, and fruit. The lower extremities, the nurse will assess the leg for edema and adequate blood circulation. And lastly, the nurse will teach the mom how to bond with the newborn baby and how to recognize cues of feeding such as sucking finger and lip smacking. And they nurse also advise patients to take lots of rest while baby is sleeping.